get right into compensation of an ABG interpretation. Now this is step 3 of the ABG interpretation. We are asking the question if it is compensated. So our 3 options here are uncompensated, partially compensated, and fully compensated. So this is what you need to know about each one of these options. So uncompensated, the pH is abnormal and nobody is helping. So whether it's respiratory or metabolic acidosis, for example, either the CO2 or the HCO3 is going to be in normal range, where it should be out of range to compensate the acid or the alkaline. Now the next 2 options are very easy because there's some simple rules that you can follow that will help you identify it immediately. So partially compensated. Partially compensated, the pH is abnormal, but so is everybody else. So if all 3 of your values, the pH, the CO2, and the HCO3, if all of those are out of range, then it is partially compensated. So remember, partially compensated, everything is abnormal. Okay, moving on to fully compensated. The way you can immediately identify this is if the pH is normal. It's the only one where the pH would actually be normal. It'll be close to being abnormal, but it is in the normal range. So you're going to see the pH between 7.35 and 7.45. Now, if you see a value that is like 7.36, it's close to being abnormal, or if it's right on the line, 7.35, then this would be an acidosis. Now, if it's on the other side of the spectrum, where it's close to being abnormal on the alkaline side, where it's exactly on 7.45, or if it's 7.44, that's where it would be alkalosis. So the big kicker here is that if it's fully compensated, your pH is going to be normal. But your other values, such as your CO2 and HCO3, of course, are not going to be normal. So let's do a quick practice question here. So we have a pH of 7.36, a CO2 of 48, an HCO3 of 28. So first step, let's determine if it's acidosis or alkalosis. Well, we see a pH of 7.36, it's in the normal range, but if we look at the other values, they're out of range, so this would be considered acidosis. CO2, let's determine now if it's respiratory or metabolic. Now you can use the tic-tac-toe method or the row method. I'm going to use the row method in this quick example. Respiratory opposite, metabolic equal. So pH is low, considering it's on the brink of being low. And then we have a CO2, 35 to 45. It's 48, it's high. So respiratory opposite, this is respiratory acidosis. Now, step number 3, what is the compensation? Is it uncompensated, partially compensated, or fully compensated? Okay, remember, number 1 rule, we can identify it immediately because what is happening? The pH is in normal range. So this is respiratory acidosis, fully compensated. Once again, you guys can have more practice questions to test your knowledge on our free ABG worksheet that you can download from our website. Go to the description below. Next one, we have a pH of 7.31, a CO2 of 38, an HCO3 of 15. All right, step number 1, acidosis or alkalosis. We have a pH that is below the 7.35, so it is acidosis. Okay, step number 2, is it respiratory or metabolic? Using either method here, you can see if you go through the steps, it's metabolic acidosis. Okay, now look, let's ask ourselves step number 3, is it compensated? Okay, we look here, that is pH is 7.31. We know that it's metabolic acidosis. We have a low HCO3 that is causing this because it's metabolic acidosis once again. So our CO2 should be compensating, so our lungs should compensate for this acidosis. So it should increase the respiration rate to expel more CO2. If you saw that, you would have a low CO2, but it's in normal range here. If you remember those simple rules earlier for the compensation, is that partially compensated, everything would be abnormal. If it was fully compensated, the pH would be in normal range. Well, here we have a value that is still in normal range because it's not helping, and that is the CO2. The CO2 is within normal range, 35 to 45, so this is uncompensated. So the answer here would be metabolic acidosis, uncompensated. All right, last question, guys, to test your knowledge. A pH is 7.32, a CO2 of 48, an HCO3 of 27. All right, step number 1, acidosis or alkalosis. It's below that 7.35, so it is acidosis. Okay, step number 2, is it respiratory or metabolic? Okay, going through either step here using the tic-tac-toe or the row method, you're going to find out that it is respiratory acidosis. Okay, so now step number 3, uncompensated, partially compensated, or fully compensated. Okay, we look here, pH is abnormal, CO2 is abnormal, HCO3 is abnormal. everything is abnormal. What's that rule? It means that this is partially compensated. Okay, so respiratory acidosis, partially compensated. And to explain the pathophysiology behind this once again, we have a respiratory system that's causing the acidosis. So to compensate, what organ needs to compensate? The kidneys. The kidneys need to compensate by increasing the alkaline. What is alkaline? Bicarb. What controls the bicarb? The kidneys. So to hold on to that bicarb is counteracting that acidosis. So that is where it's saying it is partially compensated, working on being fully compensated eventually, because at least the organ is helping here. So everything is abnormal, it's partially compensated.